Hello. I want to start by commending the healthcare workers and first responders that have continued to work tirelessly since the beginning of the pandemic in 2020. As you know, hospitals throughout the Commonwealth are experiencing an unprecedented influx of patients due to the COVID surge. This, coupled with existing staff shortages, current staff testing positive for COVID, and a reduction in elimination of volunteers, has created an unsustainable environment. I spoke with Kevin Coughlin, the administrator for Plymouth-Beth Israel Deaconess Lahey Health. The biggest challenge remains ensuring safe staff to patient ratios. Even with two National Guard members side by side, their current available staff, they're challenged with more challenges to come as the Omicron hospitalizations increase. So this week, along with the Plymouth delegation, Representatives Muratori, Lenatra, and Exaros, I sent a letter to Governor Baker requesting additional National Guardsmen be deployed at Plymouth-Beth Israel Deaconess Lahey Health. To complicate the situation, there's a higher volume of more acute patients coupled with unprecedented workforce shortages. Plymouth BID is operating at nearly full capacity and having to hold patients longer as a result of delays in transport due to ambulance staff shortages, as well as long-term care and treatment bed staff shortages. These additional National Guard personnel, if granted, would help augment auxiliary hospital staff, assist with testing and vaccines, transport, and other tasks to free up the hospital staff for direct patient needs. Absences due to COVID sickness and quarantine are also widely affecting our schools, our businesses, and our economy. The legislature created a Massachusetts COVID-19 emergency paid sick leave, where employees can take paid leave time for COVID-related illness, quarantine, vaccinations. And employers may then apply for reimbursement from the state. This is effective until April 1st, 2022. Or the exhaustion of the $75 million that's in the program. For questions regarding COVID-19 temporary emergency paid sick leave, employers can email covidsickleave@mass.gov. For questions or applying for employer reimbursements, employers can email esl@dor.state.ma.us. Now, I want to turn to one of the crucial underpinnings that supports our economy: childcare. Childcare businesses in particular, which are often small or home businesses, are challenged by varying protocols, and the lack of childcare continues to slow our economic recovery by keeping parents out of work. The good news is that the governor has indicated increased access to testing is imminent. The Commonwealth of Massachusetts Office of Early Education and Care, the EEC, is coordinating with neighborhood villages to distribute free rapid antigen test kits to childcare centers and family childcare homes. EEC is also planning a short-term expansion of its child care testing sites in January to reduce wait times and increase access to rapid turnaround PCR testing. Visit www.mass.gov childcare testing for more information. EEC encourages providers to update their program's quarantine and isolation protocols based on new CDC guidance. That's not always easy, as EEC does not have prescribed policies on quarantine and isolation for childcare. So each provider should use the CDC guidelines as the basis for their policies to support safe operations for their staff and families. Programs can also find best practices by consulting their local boards of health and public schools when identifying policies to prevent COVID transmission while keeping children safely in care. We need to focus hard on the practical aspects of overcoming this surge so that we're healthy and prepared to take full advantage of the upcoming start of the seasonal tourism economy upon which our communities depend. As chair of the Joint Committee on Consumer Protection and Public Licensure, I'm currently working on expanding the April 1st deadline to continue outdoor dining. and to continue to allow town government to allow for virtual or hybrid meetings. We've seen this creates larger participation from the public while keeping people safe. In addition to availing yourselves of vaccine and booster opportunities, I'm asking the public to follow common sense public health precautions that have served us well. Avoid large gatherings, wear a mask indoors, avoid unnecessary exposure so we do have enough tests for those that truly need them in terms of vulnerable health and age. This way, we will be prepared and resilient. Our coordination and collaboration as a region will help us to ride out the Omicron surge. If you have questions, please don't hesitate to email me at susan.moran@mass.gov.com. We can do this.